Hello and welcome back. Session number 2 in Unit 4, Principles of Exercise, Fitness and Health. And in the last webinar, the first one in this series, we touched on how the body begins to change when we exercise. And what we want to do in this webinar is look in a lot more detail of what those effects of exercise are on the human body, which parts of the body will change and adapt as we exercise, and what exactly will those changes be. And in particular, we've got our learning outcomes that we always like to go through, just so everyone's clear on what we're trying to cover. And we're going to go over these as we always do. And we're going to be able to describe the cardiovascular and respiratory adaptations to endurance and aerobic training. So we're looking at the heart and lungs and how they can change during aerobic training. We're going to identify the short and long-term effects on blood pressure of when we start to exercise. We're going to be able to look and describe blood pooling and how exercise can affect that. We're going to look at the effects of exercise on the bones and the joints. We're going to look at something called the DOMS. Any of you guys out there who do any weight training right now, you'll probably already know what the DOMS is, delayed onset of muscle soreness. And we're going to look at what that is and why it comes about and how to avoid it as well. And we're going to look at the short and long-term effects of different types of exercise on muscle tissue. And finally, we're going to cover off different types of exercise that can help us to improve our posture. So, quite a lot to cover, so let's get going. And as we already know from the A&P module, the cardiovascular, respiratory and neuromuscular system, we should already have an understanding of what those are. The cardiovascular system is the heart, and we push the blood around the body so that we can deliver oxygen to the muscles and get rid of that C2O. Respiratory system is the lungs and the process of breathing. And then we have the neuromuscular system, which is the nerves and the muscles, okay? And what it says really on this presentation is exercise is a stimulus which results in adaptations to the following. We have the heart, blood vessels, lungs, and metabolic function. And let's break that down a little bit more so we can get a greater understanding. Let's look at the heart first of all. So when we start to exercise, the size of the heart will change, and this will happen over time, okay? As we exercise, as we get stronger, and as our heart gets stronger, it will get bigger, and that's called a ventricular hypertrophy. And anyone who's training at the moment, particularly in a gym or bodybuilding type environment, might have heard the word hypertrophy. Hypertrophy means to gain size in the muscles, and then ventricular, that means the ventricles in the heart. So we're going to gain size in the ventricles in the heart, and those chambers of the heart are going to become thicker and stronger. And when they contract, they're going to contract more strongly. They're going to be squeezing more blood through the body. And what that means is we're going to have something called increased stroke volume and increased cardiac output. And essentially, what we're saying there is because the heart's got bigger and stronger as we start to exercise, when it does beat, it will push more blood around the body per beat. What that also means is because our heart's a lot stronger, when we're resting, the heart doesn't need to work as hard. So, say at the moment, if my heart, I'm an untrained person, just for example, my heart might need to be, 120 times a minute to get enough blood around my body. As I start to train and exercise, that will start to come down, and the amount of times that my heart needs to beat per minute will be a lot less, because every time it does beat, more blood will be moved around the body. Last thing we want to look at is there is increased blood vessel size. So the arteries, capillaries, veins will get bigger and stronger, as well as the heart, and they'll be able to carry more blood around the body. And finally, there's a decreased risk of heart disease. So the more active our heart is, the more it works out, the more or the less chance there is of us contracting heart disease. And it might sound like quite an obvious point, but the heart is exercised when we do CV or aerobic type training. So if you imagine going for a run on the treadmill, using the exercise bike, the cross trainer, the recumbent bike, rowing machine, any of those sorts of continuous endurance type activities, they're going to be training our heart and the CV system, okay? If we're doing weights, for example, if we're doing a bicep curl, we might get a little bit out of breath and there might be some slight benefits to the heart, but that's more going to be an exercise that benefits our muscular strength. So we've just touched on blood vessels, but just to look at them in a little bit more depth. So I'll have reduced systolic and diastolic blood pressure, and we should know that from our AMP module, okay? Systolic is the pressure when the heart is beating. Diastolic is the pressure running through those blood vessels when the heart, in between beats, so when the heart is more relaxed. And the pressure in those blood vessels will come down as we exercise. So as we're taking part in these CV activities, the pressure in the blood vessels will be less, okay? And the lower the pressure is, as long as it doesn't get too low, the more healthy the human being is going to be. There's also a favourable change in blood lipids, increased haemoglobin, and increased blood volume. And just to touch on those in a little bit more depth, so blood lipids is the amount of fat that's carried in the blood vessels. If someone is overweight, if they have a particularly high fat diet, we can find that fats are stored on the artery walls, and they can cause arteries to be blocked, and they can make sort of our arteries they can make it difficult for the blood to flow through the arteries, and for it to flow through these fatty areas, there needs to be more pressure. So again, the pressure will come down as we have less fat stored in the arteries. We have increased haemoglobin. So haemoglobin is an element inside the blood that we use to carry around oxygen. Inside those red blood cells that we looked at the AMP, we have haemoglobin, and haemoglobin is what takes the oxygen around the body, and we have more of that because we're exercising. And finally, we have increased blood volume, and that's very simple. We have more blood available to use in the body. Adaptations to the lungs. So we all know what the lungs are from AMP. They help us to breathe, and it's where the gaseous exchange takes place. And we have increased functional capacity during exercise, and to dumb that down and to put it into layman's terms really, what that means is that our lungs work more effectively during exercise. So we've all probably, or you can all imagine a scene where someone who's very out of shape comes back to exercise after a long time being away, okay? And they start to exercise and they get out of breath very, very quickly. As we start to exercise and as we work out more, the lungs become stronger and they have more function that we can use during exercise. We also have increased diffusion of respiratory gases. So what that means is that the lungs will, what they'll be able to do is they'll, essentially what I'm trying to say is that the lungs will be able to diffuse more gas. So as well as them working more effectively, the rate of diffusion will be higher than what it previously was. So this is a very basic example, but let's say previously we were able to diffuse 10 oxygen molecules per breath. As we start to work out, that might go up to 15, 20, 25, and we don't need to know the exact number, but we do need to know that the lungs will get more, will become better at that process. And there'll also be increased vital capacity, so there'll be increased capacity for the lungs to work under stress. Metabolic function. So anyone who doesn't know what metabolism is, all right? Metabolism is the rate at which the body burns and uses energy. And someone who has a high metabolism tends to have quite low body fat. Someone who has a slower or a lower metabolism will tend to carry more body fat, because if we have a high metabolism, it means that our body is using more energy, and if we have a lower metabolism, it means our body is losing less energy. And as we exercise, the body needs to use more energy, and what that means is we're using more calories and more energy per day, and therefore we have reduced body fat because we're using our fat stores for energy. What we also have on this slide is we have decreased insulin resistance and improved glucose tolerance. And whenever we exercise, we use we've looked at it really in A&P, but we use glucose as a fuel, and to break down that glucose, it requires insulin, and the way in which the body uses insulin becomes better and more efficient as we start to work out more, and I think that's the big takeaway from this one. We're getting into sort of some level 3 type areas, but when we work out and when we break down energy, there's always an insulin release in the body, and those of us that don't do that very well tend to carry more weight, and in extreme circumstances it can lead to someone having diabetes. Those of us who work out a lot and have a high metabolism and can use insulin in a good way will tend to have less body fat, and that's the big takeaway from this slide. And we also have increased maximal O2 uptake, so we can use more oxygen, which I think we touched on when we spoke about the lungs. Let's have a look at the muscles. So we have increased capillarization. So what that means is we have more capillaries in the muscles, so we can get more oxygen in and out and more CO2 in and out, and that's essentially what happens as we start to work out more. We'll have more capillaries in the muscles. We'll have increased enzymatic function within muscle cells, so we'll have more enzymes doing more work inside the muscle cells. We'll have the increased size and number of mitochondria, so again, those are where the gaseous exchange takes place, and we'll have more of those cells to do that in our body, and that's really beneficial, because the more oxygen we can get in and out, the more efficiently and the harder we can train and the harder we can work. We'll also have more toned muscles, so I think most of you will probably already know, when you go to the gym and when you start to work out and you start to use weights or resistance machines, you'll have more toned muscles. And just a quick point on that really, I know we touched on the appropriate exercises for training the heart and lungs. So if we want to train the muscles, we're going to be looking at free weights and resistance machines. So stuff like, to give you some examples in case you're not aware, squats, bicep curls, chest press, military press, shoulder press, all those resistance type activities are going to have a predominant effect on our muscles, okay? Don't get me wrong, if we did 100 squats in a row as quickly as we could, we're going to be out of breath and it's going to work the CV system as well. But if we're doing stuff like 12 reps, 4 sets on each exercise, that's going to have a more noticeable effect on our muscular system. We also have some psychological factors that we need to be aware of. So, improved self-mastery, improved social interaction, distraction from daily routine, and decreased depression and anxiety. And really, I think these factors can get ignored. Everyone knows that if you go to the gym, you get fatter. I mean, everyone knows if you go to the gym, you'll get thinner and you'll burn body fat. What people tend to not know as much about, or not want to know as much about for one reason or another, is some of the psychological factors. And going to the gym is very, very good for our psyche. There's a distraction from our daily routine. So let's say, for example, you've been in the office all day and you want to de-stress. There's nothing better than going to the gym or going for a run or going out on a cycle to get away from that routine, to help us to think. Physical activity can play a really big, really important part in that. We also have decreased depression and anxiety, and there's lots and lots of clinical studies that have shown that people who work out on a regular basis are less likely to be depressed or have anxiety issues. Increased social interaction. Again, there's some papers published around this showing that people who work out tend to have more social skills. And again, if if you think about if someone's going to a group workout, if they're going on a group run, if they're in a cycle club, a football team, basketball team, there's going to be more social interaction going on. Sure, you get you guys who go into the gym and they just want to do weights and train on their own, and that's up to them, each to their own. But there's a lot of opportunity for social interaction going on within the fitness environment. And finally, we've got improved self-mastery. And what that means is we can master more skills. So we become more skilled, we know our bodies in a superior way, and that helps us to master more skills. Okay, let's have a look at blood pressure in a little bit more detail. So in the short term, heavy weight training and isometric exercise will significantly increase both systolic and diastolic blood pressure. However, at lesser intensities during exertion, DBP, so diastolic blood pressure, may decrease slightly due to vasodilation. All right, and let's break that down so that everyone understands. So, in the short term, when you use weights or when you do an isometric exercise, so remember an isometric exercise is something like a static contraction, so something like holding the plank position or sitting against a wall in a wall sit position, that will raise our blood pressure. So whilst we're doing the exercise, in that period whilst we're exercising, our blood pressure will be raised, okay? And that's important to know, particularly if we're working with people like pregnant women, or the elderly, where we don't want to raise blood pressure. So we have to be careful when we're using weight training or isometric exercise because we don't want that blood pressure to be too high. However, at lesser intensities during exertion, diastolic blood pressure may decrease slightly due to vasodilation. And vasodilation is the process of the blood vessels becoming dilated and bigger, and because of that, it means that the pressure when the heart isn't pumping, so diastolic, when the heart isn't pumping, there'll be less pressure. Alright, hope that makes sense, and we'll just cover it one more time just in case. At lesser intensities, diastolic blood pressure, so at lesser intensities, the pressure when the heart isn't beating may decrease because the blood vessels get bigger and widen during exercise. And then just below that, we've got the long-term effects. So over time, aerobic exercise using large muscle groups in rhythmical activity is very effective in reducing both systolic and diastolic blood pressure. So aerobic exercise, so again, we'll cover those points off. Something like going for a run, using the treadmill, cycling, rowing, using the cross trainer. Over long term, okay, they will bring down the blood pressure both systolically and diastolically. So any clients who come to you, and again, you'd want to do a GP referral qualification in order to do this safely and have the qualifications to do it. But if you're looking to bring down someone's blood pressure, we can definitely do that through using aerobic activity, and that's going to be our predominant tool for bringing down that blood pressure. Blood pooling. So we already know what blood pooling is from our AMP, okay? And what we've got on this slide, and I'm just going to read through it for you, okay? During exercise, as the heart rate rises, there's an increased flow of blood to the muscles. And should the activity suddenly stop, the heart will continue pumping blood at an elevated rate for some time. Since the muscles will now stop working, this extra blood will begin to build up or pool in large muscle groups. This is called blood pooling, and the legs are most commonly affected due to the influence of gravity. So really, what we're saying here is blood pooling occurs because, say if we do a really, really intense workout, something like, 5 sets of 400 meter sprints with a real brief rest period in between each one. That's going to be a tough activity, okay? My heart rate is going to be sky high. And I'm going to suddenly stop. Alright, there's going to be no cool down period. I'm just going to stop. And my heart is still going to be beating at an elevated rate for some period of time. And because my heart is working harder, still pumping more blood around the body, which we don't necessarily need because we're not working anymore, this will cause blood to pool in some of the larger muscle groups. And in particular, this can happen in the legs because gravity takes blood down towards the legs. And in order to remedy that, particularly in the legs, we can lie someone on the floor, raise up their legs, and help that blood to flow back towards the heart and the brain. And you can maybe tell if blood pooling is going on because someone may feel sick, dizzy, or they could even faint. So we have touched on it before, but any first aid you want to give, you do need to be qualified for, but it would be a case of raising up that person's legs and getting that blood back towards the heart. Okay, effects of exercise on the bones and joints. So remember back to the bones and joints, we have our synovial joints, which are the joints in the body that give us the most amount of movement. The short-term response, I think as we already know, is that there'll be increased synovial fluid in that joint. So when we start to exercise, there'll be more synovial fluid in the joint so that we've got plenty of lubrication going on there and there's no friction and we can exercise pain-free. We've then got long-term adaptations to weight-bearing exercises. So the first one with the synovial fluid, that's for any movement or exercise. The second one is weight-bearing exercise. So again, resistance machines, free weights, body weight exercises where we're using resistance. So we're going to have stronger ligaments, increased bone density, and reduced loss of bone mass with associated age. So let's break them down a little bit more. People who do weight training will have stronger ligaments, and this is going to be beneficial for everyone, whatever their sport is. Okay, so if you've got a client who let's go to the most basic example. If you've got a client who wants to gain muscle mass, of course we're going to be doing resistance exercises. If you've got a client who wants to run a personal best for the 10k, what we might not think, or what you might be thinking straight away is, right, let's get on the road, let's do some running. But we can also use some weight-bearing exercise to strengthen up the ligaments as well, to increase the bone density. And when we say increase bone density, we mean that we're going to make the bones denser and stronger. And people who are older, if they are doing weight training and weight-bearing exercises, their bones won't lose their density at the same rate as someone who doesn't do any weight-bearing exercise. And whenever we do weight-bearing exercise, we have something called the DOMS, and we all probably know about the DOMS. It's the name given to pain and soreness or stiffness experienced in muscles 12 to 72 hours after exercise. And for me personally, I normally get the DOMS maybe 48 hours after my exercise. A day after, I'm okay. The day after that, that's when the DOMS normally comes on for me. And the DOMS is that feeling that the muscle may feel more tense or particularly sore, especially if you touch it or press it. You know, if you do a chest workout and then you touch or press that muscle, it might feel a bit sore and a bit tense and a bit achy. That's the DOMS, all right? It's delayed onset muscle soreness. And you can really tell from the name, delayed onset, it's something that comes on after a period of time. You know, it has a delay to it. All right, in the short term, we have diversion of blood to the working muscles and away from the non-essential organs. So this can cause the DOMS, all right? And what can happen is when we work out, particularly if we're doing resistance-based exercises, and I'll use the chest press again for an example. If I was to go and do chest press and do 10 sets of 10 to 12 reps, what would happen is lots and lots of blood would get pumped into my chest, and my chest would appear to be pumped up. So that's a phrase that you often hear from bodybuilders, let's go and get the pump. And you get a pump in a muscle when it gets really, really full of blood. And when we work our muscle very, very, very hard and we really push it, we get as much blood in there as possible, and that pumps the muscle up, and that can make it look as if the muscle has an increased diameter, and it looks bigger, and that can cause the DOMS. In the long term, repetition of any activity will enhance neuromuscular connections, helping motor unit recruitment. And I think we covered that off as well during AMP. As we start to use different muscle groups, especially for resistance exercises, we begin to learn how to recruit more of those motor neurons. And the more motor neurons we can join up and we can use, the stronger we can become. Let's have a look at this, okay? So let's break down the benefits of aerobic and resistance training. So aerobic, remember, that's our CV type exercise, that's our endurance type activity, and predominantly that's going to be using our type 1 muscle fibres. And we're going to have more mitochondria in the muscles, more capillaries surrounding the muscle fibres, and we're going to have an increased number of enzymes and stored glycogen in the muscle, so that if we do need to exercise, we can do for longer. Alright, resistance training, that's going to predominantly work our type 2 fibres, particularly if we're going short duration, high intensity, and we're going to be able to use our nervous system in a way that we probably couldn't previously, because we can use more motor units. There may be an increase in the size or diameter of the muscle, which is called hypertrophy. So as the muscle gets bigger and stronger over time, that's called hypertrophy. It may get a pump in the short term, so lots and lots of blood might get in there and the muscle may appear to be pumped up, and there'll be an increase in the glycolytic activity of the muscle, so we'll be able to use glycogen more efficiently. Getting towards the end now, so stay with me. I know it's been a difficult one with lots of different subjects covered off, but we do need to look at exercises which can improve posture. And of course, this is very important as a PT, because we get a lot of people come to us with poor posture, especially if they've been driving all day. They have a job sort of as a lorry driver, doing deliveries, whatever it might be. If someone sits at a desk for a long period of time, that can also cause them to have poor posture. And as PTs or as gym instructors, we want to make people more healthy. And the way that we can do this is through exercise. And what we want to do, we want to put the person back to the way they should be. And there's obviously different exercises for different postural defects, and we're not going to be able to cover all of them off in this shorter presentation today. However, in general, what we need to be looking at doing to help people with their posture and to give them a greater posture is we should be having a full range of movement exercises. So that means that we shouldn't just be concentrating on one area of the body. You know, if we come in and we do chest every day, that's going to mean our chest's going to get very tight, it's going to get stronger, and because the chest is getting tighter, it's going to pull our back more forwards. We should be engaging and using all muscles in the body to keep a nice equal sort of equilibrium and balance between all of the muscles. We should be using compound movements. So compound movements are movements that use all of the big muscle fibers in the body. So things like the squat, a chest press, a pull-up, they use lots of muscles. Something like a bicep curl only uses the bicep, and we want to be using the activities that help us to engage more muscles, and that's going to help us to improve posture. We should be doing freestanding. So if we can be doing resistance activities where we're freestanding, that's going to help with our posture. Rather than sitting down in a machine, a resistance machine, if we can stand up and work out, that's going to help with our posture. And we should be using free weights and cables, as we've covered off just. And we should be doing an equal number of push and pull exercises. And as we've said, that's to keep the balance between the different muscle groups. So you imagine all the push exercises that we do, they're going to be engaging the chest and the triceps and the shoulders. All of the pull exercises, they're going to be engaging the back and the biceps. And that's why it's important to have an equal number of each one, so that we've got a good balance between our different muscle groups. And we should also be doing dynamic and developmental stretches in order to keep us moving in the correct way. So, learning outcomes, we've come towards the end now, and we should be able to describe the cardiovascular and respiratory adaptations to the heart and training. Remember, the heart gets bigger and stronger, The veins and the arteries will also get bigger and wider and stronger, and because of that, it's going to reduce our blood pressure. Remember blood pooling and what that is. When we work at a high intensity, the heart will continue to beat and blood will then be pooled in the major muscle groups. We should be able to describe the effects of exercise on the bones in terms of then becoming more dense, becoming stronger, ligaments getting stronger, and in the short term that synovial fluid being released into the joint. We should know what the DOMS is, and we should also know how that comes about. And we should also be able to look at the short and long term effects of different types of effect on the muscle, which we have, remember, our type 1 muscle fibres and our type 2 muscle fibres are engaged by different activities, whether it be CV or resistance type activities, and what the adaptations are going to be in those areas. And we should also be able to describe the exercises that improve posture. Remember, predominantly freestanding, resistance type activities, using free weights and maybe cables. I hope it's all made sense, guys. As always, there's been a lot covered in this one, so if you do need to go back and replay some areas, please do. Need anything at all, drop me a line, and I'll see you again soon at the next presentation.